So in your style of working, do you make reference to or follow any other MFR practitioners?
Can I
You
take
may,
the start
you
of this
may,
one?
yeah.
Yeah, I actually follow Walt. Walt's philosophy was really refreshing for me and for my practice, and opening up to what we both do and don't know as a practitioner is so powerful. Because as soon as you are willing to have a working hypothesis as opposed to a diagnosis, a lot of things start to shift between you and the patient or client. Would you agree with me on that?
Yes, yeah.
And I think that from my original training, which was kind of fascia based, structural integration based, that it was never looking for a diagnosis. It was never looking for that bit that stops us moving or bit that stops us changing, or the chicken.
Frozen chicken.
The frozen chicken,
yeah.
which you'll have to explain.
I will.
That actually, if we're going with working hypothesis, looking along the tissues and going, okay, what am I feeling? What am I not feeling? What do I think I'm going to feel? What do I think they're going to feel? Why don't I ask them what they're feeling? Because then that brings them into the treatment as well.
Yeah. And if you're a fascial trained therapist, when you feel things, it's all about the fascia. If you're a muscle trained therapist, well, you're feeling muscle spasm or muscle tension, right? You know, a lymphedema therapist is feeling pooled. It's like rabbit holes. It's all rabbit holes. Anyway. Okay, so besides me, who else did you train with? You didn't train with me.
I didn't train with you. No,
virtually.
Virtually.
Yeah.
We've known each other online for 6 months,
maybe
longer, So I trained in Brighton with a wonderful practitioner called Rachel Fairweather, who was eye-opening and inspiring, and she's a real healer in all senses of that terminology, in the sense that you can actually be in her presence and feel quite relaxed and quite free to be who you are, and maybe to let your body let go of certain things. That was the basis of my training.
Good, yeah. And my training actually started in college. I had a college professor who had done a lot of myofascial training in the late 70s, early 80s with Barnes and Upledger, and she, back in university back then, kind of closed the door so nobody else would see her, teaching us a little bit of the work, which was kind of interesting. And then I trained primarily with my myofascial training with John Barnes, who's in the States one of the more well-known people. Trained with him, worked for him for about 10 years, and then went separate ways for a lot of different reasons. Had a lot of other training with some nerve-based folks, some skin-based folks, some other kind of plucky ways to look at manual therapy folks. Diane Jacobs is a Canadian physiotherapist who I admire a lot. She taught me a lot about neuroscience-based approaches to manual therapy, it kind of blew the top of my head off when I had to really reframe, what if it's not about the fascia, what can it be? And it's like, it can be all these other things. Just take a look, right? And it's not about pick a card, any card. It's like, which is more plausible? So I learned great manual skills from John Barnes, and I learned great brain skills from Diane Jacobs and a couple other people through the similar community of neuroscience-based manual therapists. So, yeah. And just hope I keep learning. Yeah.
Same here.
Yeah, that's why we're here.
That's why we're here.
Yeah. I'll just call into a few of the other people who I'm learning not directly from them, but by reading some of the evidence that's out there, learning their take on work. Nelson Roy's an American speech pathologist researcher who, he's one of the earlier people who talked about the treatment of muscle tension dysphonia with manual circumlaryngeal technique. And that concept, and I love going through the history of his papers because it's all about the manual circumlaryngeal work for muscle tension dysphonia, as if the muscle tension is there in isolation, right? We feel the tension, we palpate it, then we do something to affect the tone right there. But then when you read some of his later papers, a 2006 paper, and he really talks about the complexity of it, that it isn't just muscle tension. It's the thing that we call it, but it's a cascade of all sorts of neurological, interpersonal, and interdynamic.
The causality.
Yeah. We still have to call it something, so it's muscle tension dysphonia, and we're working with the tone and tension, but it's so much more complex, and I love that. It's like the more we know, the less we really know, or the less we can be certain of. Which is a tough thing for some people to say, but I embrace my lack of knowledge.